Fessler here, and some of you all had patients with wound vacs, and you want to know more. So I am here to help you learn more about wound vacs. Be right back. Okay, several things you will need, no matter where you do this at. Suture removal tray. You need scissors out of that. Some gauze. Some sterile normal saline. A sterile syringe to irrigate your wound out with, using that sterile normal saline. Adhesive remover and skin barrier grips. Sterile gloves in a hospital setting. Several pair of clean gloves in the size that's appropriate for you. Your wound vac kit that has your track pad and your drapes in it and your sponge. Now you may have an order for silver infused foam, so it's more of a grayish color versus the blackish color. We'll be using that today since it is already open. This is your track pad, so it is connected to the tubing that goes to your wound vac that has the canister that collects the drainage. And these are your drapes. This dressing change requires a lot of arts and crafts. So let's get started. So some of you all may get the opportunity to assist the wound care nurse with changing one of these dressings, applying the dressing, and or removing the dressing. In the home setting, this is a clean technique. On a surgically debrided wound, it is as much sterile as possible touches the wound bed. Because we do not want to introduce them to anything that's in the hospital setting, that's for sure. Okay, with my clean gloves, I'm going to remove this previously applied damp to dry dressing and prepare the wound for application of a wound vac. Okay, buddy, let's roll on over and moon these fine people. Yep, that's what he's known for. So usually I would be in a more comfortable position for this particular procedure. Okay, did my hand hygiene, donned my clean gloves, used my adhesive remover wipe to remove the dressing that the OR placed, as they wanted the wound care nurse to place a wound vac. And you are going to have wounds of all different sizes and shapes and places, and sometimes you have to be innovative to get a good seal so that the wound vac does its job the way it was meant to be. Okay, so if you have an order for a wound culture, you're going to clean this first and then culture. So again, we're just going to use clean gloves, hand hygiene every time you move gloves. So again, this is clean procedure until you get ready to start working with the foam cut into the wound bed. So I have a brand new bottle of sterile normal saline that I hope to remove the way it shows to remove. Okay, so the only thing that needs to be sterile is the part that goes down into the saline. I have my gauze. I'm going to draw up some sterile normal saline to irrigate my wound bed. We don't want to wipe the wound bed because that will start the whole pro-inflammatory process again. So I'm going to get my gauze and I'm just rinsing that out. Okay. So as you can tell, there's some saline left in the wound bed. So if your patient is mobile, or if you have assistants, or they're very lightweight, you can turn them and let gravity take it out. Or you can take a corner of gauze that you didn't touch, still sterile, and wick that out. But since you are applying a wound vac, it's not that important to get all of that removed. I like to take any leftover saline, clean my skin around it, and you can pat that dry with your sterile gauze, because we're going to apply skin barrier prep to the skin. This is meant to protect the patient's skin, but what it also does is it helps adhesives stick better to the actual film and not the skin. So I'm going to put, everywhere I'm going to have drape, I'm going to put that skin barrier down. I let it dry, and I like to do this 3 times. And that's just to really help protect the skin. If this wound vac quits working, they may get drainage out there on the intact skin, and that can cause moisture-associated dermatitis. Makes it break down, makes the areas that's already healed start breaking down. And then a 3rd time. Okay. And that was a new one every time. So now we have the wound bed ready. Okay, I have my packages open. 2 sets of sterile gloves, because you're going to need them. Okay, so back to our wound. Oh, there we go. All right. So I have everything about waist height. Remove my clean gloves. I'm going to do my handy hygiene. I didn't land on the patient this time. That foam gets crazy. Alrighty, sterile gloves. Your favorite part. You notice I got the ones that weren't so folded up too. I like to use a pair. I like to use my sterile gloves that are size smaller than my knee. So I can get rid of baggy fingers a lot easier. Now technically I like to go ahead and dump my stuff from my suture removal tray onto my glove package so that I don't accidentally contaminate my gloves trying to get those scissors out of there. Oh, I love latex. Oh.
Mrs. Lovelace?
Not in here. Mrs. Fessler's in here.
Okay.
Okay.
I'm just interpreting what that door open means.
That means I'm here.
That means
and not in my office.
Here.
Mm-hmm.
Okay, and probably at least you. And what is that?
I am applying a wound vac because some students are wanting to know what that entails.
Oh.
Okay. And you're on video.
And you're on video?
You are.
And really?
Yeah. They always cut the foam, not over the wound
Oh,
vac.
shoot. I get it. Okay. All right. Thanks for sharing that with me.
Okay.
Have a good day.
You too. Bye-bye. See you tomorrow. And then
Most
you want
embarrassing
to...
moment for today.
Okay. You want to kind of brush any loose pieces of foam off. And then you're trying to get it cut to match that wound bed because we don't want it overlapping the wound bed. We want a nice, somewhat snug fit in there. And you always have to keep track of how many pieces of foam you put in there so the next person knows how many they should have removed. And you don't want to get rid of these extra little pieces because you might be using them for your bridges. All right, so let's knock the little pieces off. I'm going to turn the patient towards me. Yeah, that looks perfect. I didn't actually touch the skin or contaminate my gloves. So now I can get my drape because we want to put drape down first to protect the skin from the actual suction. Now, what I found is the best for these smaller wounds that don't require this huge sheet. Just go ahead and cut it in half. Again, between the waist and shoulders in the sterile zone. And I can lay that down. And then I can cut some strips about the size I think I need for my area. Because we put one under and one over the foam, but not on the wound bed. Okay, and this goes all the way out to the edge. And I want to put a bunch of adhesive outside of where we really need it. I'm just going to trim that back a little. You have to be careful how you cut this because it has a 1 and a 2, and you want to be able to remove that. And then I double check to make sure my foam is going to be covered. And then I can go ahead and cut a second piece in the same size. But we can leave it a little bit longer to make up for the space that the foam will take up. Okay, so number 1 is first. So as you're pulling number 1 off, you know that one goes down and it's sticky side down. But I forgot to cut a hole in. So that one's trash. And again, I didn't touch anything but the drape, not the part that actually touched him. So we will toss that piece. So what I was going to show you was, with this, we want to cut a hole about the same size in the middle of the one that goes down on the skin first, so we can put our foam down into our wound. So just like in elementary school, fold it over. And if you need to, you can fold it in the other direction if you need to make it more uniform. We got fortunate and had a perfectly circular wound. Imagine that. That is just pure surgical finesse. And again, it doesn't have to be 100% perfect because we are just wanting to protect that skin. So again, number one down first. And we're just wanting to protect that skin around that wound. Get it smoothed out as much as possible. Okay, so we've done number one on that side. Now we're doing number one on this side. Smooth it down. And then we got to pull number two off the top. And again, you're just kind of smoothing that out as you go. Okay. Again, none of that touched the patient's skin. I only touched the drape that was sterile. So, and then you pull this blue thing off. Sometimes I forget. And then end up taping on top of it. So it's okay if you go a little long. This, again, is definitely an art to it. It comes with time. And we're going to put our foam in. There we go. And then we take our second strip and pull the backing off over here, because I'm going to have to get this lined up. Now, if you have baggy fingers, this is when you're going to run into trouble. So fingers down, and you're smashing that foam down as you apply that drape. Again, you have one and two. We have to open up the area for the trackpad. So for our dressing, we only used one piece of foam because we didn't have to bridge it anywhere, but you even include bridges in your foam count. And you want to make that big enough so that those little suction areas can have a place to really pull that drainage out. Okay. So the trackpad is also numbered. Close your clamp. The clamp is flipped. And we're just going to take, I want to have this come up this way off the wound. I'm going to center that very center part of my trackpad over that hole that I cut in the drape. And then pull the backing off, the rest of the backing. And then there's another backing on top. So just grab this blue thing. You don't have to pick to separate anything, just grab the blue thing, smooth that out as you pull it off. It has a split in it, so you don't have to thread it off that hose. And that's on there. So at this point, if I'm starting out with a whole new system, I can take my gloves off, do my hand hygiene. I don't really need gloves at this point unless my patient, you know, I'm unsure about his hygiene. And again, hand hygiene for every time you remove gloves. So I don't really have a wound vac pump or vacuum, so I'm going to have to improvise and use our regular vacuum, which of course you know is very noisy. You would never do this on a real patient, but I don't know if it during a power outage, so I just connected it like that. A real wound vac tubing canister will have another cap that you push down, turn, and it clicks into place. So and unclamp your clamp once you get that connected, and then turn your suction on. And you're looking for it to suck down and harden. This is usually pretty painful for a patient. I got a blister from raking, I know. And basically that's what it'll do. Your usual settings are negative, of course, 125 millimeters mercury, and it's usually intermittent. Some doctors may order continuous. It's based on whatever the wound is caused by, what's going on, the exudate, those kind of things. So again, when you're assessing this, you're assessing the side, so you're assessing the skin around it. You're assessing the drainage in the tubing, because what's collected in the canister may be from 3 days. So we want to go by what is draining right here closest to the patient. Color, amount, consistency. You're not going to smell aroma because this is a closed system. It's dull. So yeah, there's your wound vac. Turn this off. So with a real wound vac, what it's going to do is it will beep at you and it won't suck down if you have a leak anywhere. So this is when that extra drape that you saved comes in handy, because you can come in and just kind of with your gloved hand kind of press around and see where it does suck down. Then you know exactly where your leak is at. It's usually not the trackpad, but it could be. And then again, you're just going to seal that area. If for some reason there's a malfunction or someone can't get this dressing fixed for the patient right away, then and it's going to be more than 2 hours, then it will need to be a damp to dry dressing, and the family, if they're in the home setting, needs to be taught how to do it that way. Nurses in the hospital setting, of course, you should know how to do a damp to dry at this point, until the wound care nurse can come and put a brand new dressing on. Again, if you can't get a seal, or even if you have a malfunction and there's not another one available in the hospital, then you're going to have to go for damp to dry. So that was the foam with the silver in it. For the wound vac. Now, your nurses may do this differently. It depends on where they work, what their policies are, what their practice may be. So ask questions and learn as much as you can every opportunity you get to go in and help with a wound vac.